Good afternoon, everyone. My name is Amzie Hecht. I'm a fellow serving in residence at the Office of Planning, Research, and Evaluation, or OPRE for short. I work with the federal team that oversees the Pathways to Work Evidence Clearinghouse, which includes my colleagues Kim Klum, Amelia Popham, and Claire DeSalvo. On behalf of our team at OPRE, I want to welcome and thank you for joining us today. I'm pleased to have this opportunity to share with you the findings from the latest research synthesis that our partners at Mathematica conducted. The synthesis distills key findings from the research on employment and training programs. And our hope in developing the synthesis report was to find ways to bring prior evidence to bear on the current decisions that are being made by TANF administrators and leaders of other human services and community-based organizations. Here's a brief overview of our presentation today. I'll start off by providing introductions of each of our panelists. And then, because the findings summarized today draw on the research that's been identified, reviewed, and cataloged by the Pathways Clearinghouse, I'll provide a brief summary of Pathways' goals and approach. I'll then turn it over to my colleague Andre, who will summarize findings from the new Pathways meta-analysis. Sarah will then moderate a discussion with Kinsey and Harry on their thoughts on the research and how it can be used in decisions for policy and practice. And then we'll save time at the end for questions. I'm pleased to introduce the other terrific members of our panel. We have first Andre Streki, who is a researcher at Mathematica and led the development of the synthesis report that we'll be focusing on today. Sarah Dolphin is a senior researcher at Mathematica and the principal investigator of the Pathways Clearinghouse. Kinsey Dinan is the deputy commissioner in the Office of Research and Policy Innovation in the New York Department of Social Services. And Harry Holzer is a professor of public policy in the McCourt School of Public Policy at Georgetown University. Now, as I promised, I'll provide a brief overview of the Pathways Clearinghouse before I hand it over to Andre. Our origin story is that the Pathways Clearinghouse was created through a congressional mandate. Congress directed the U.S. Department of Health and Human Services, which is where OPRE sits, to create a database of projects, which we refer to as interventions, that have used a proven or a promising approach to improving labor market outcomes for job seekers with low incomes. The Pathways Clearinghouse reflects a great deal of careful and thoughtful planning and work by our office and our project team led by Mathematica to deliver on that mandate. To create the clearinghouse, we consulted broadly with a lot of different folks, including TANF administrators, workforce development providers, policymakers, and researchers, all to ensure that the clearinghouse meets the needs of its potential users. The result is a rigorous review that presents a great deal of detail on sometimes very complex information in ways that are designed to be transparent and easy to understand. And we house all of that information on our website, which you can see here. Interventions cataloged by the clearinghouse are reviewed and given a rating that reflects how strong the evidence is that they're effective in improving labor market outcomes like employment, earnings, education and training, and receipt of public benefits. You can find the results of that process through the website's Find Interventions That Work portal, which is highlighted in the screenshot here. In addition to information about specific interventions, the site has other resources like videos and products that synthesize what we're learning from the evidence. You can find those products, which include the meta-analysis report that we're discussing today, under Other Pathways resources, again, highlighted on the page here. Now I'm going to turn it over to Andre to talk about what we learned through this new report, which was focused on understanding the types of interventions that are most likely to help improve labor market outcomes for individuals with low incomes. And our hope is that this analysis can guide some of the decisions that policymakers and practitioners make as they design and fund programs. Over to you, Andre.
Thank you, Amzie, and good afternoon, everybody. Today, I will provide an overview of findings from the meta-analysis report, focusing on the following research questions. What type of interventions work to improve the employment and earnings of people with low incomes? Which interventions are the most effective overall, and which outcomes do they improve? To what extent are specific features of interventions, outcomes, participants, and contexts linked to stronger labor market outcomes? First, I want to walk you through the analysis I led to get to those findings. For this synthesis, we conducted meta-analysis on the full body of evaluation research on pathways programs with common labor market outcomes that were rated as having high or moderate quality evidence ratings. So this universe of program encompasses 191 studies on 144 interventions and included more than 1,800 findings and effect sizes. So this is a subset of the 315 studies that were initially reviewed. These are studies with the highest ratings. So how we conducted our analysis. So we grouped studies based on different characteristics, such as type of intervention, services, and outcomes, context, demographic characteristics, study characteristics, and then synthesize the data to understand how those features relate to intervention effectiveness. We used meta-analysis, a meta-regression to see which of these characteristics of interventions and studies had the strongest links to improving outcomes for people with low incomes. So what are these methods and why did we use them? A meta-analysis allows us to pool information across multiple studies and produces average estimates of impacts with more weight usually given to more precise estimates. At the heart of this is the effect size metric, which allows us to compare different outcomes on the same scale, such as educational degree attainment and annual earnings. Meta-regression is a tool used in meta-analysis to investigate how different factors, such as participants or contextual characteristics, are related to intervention impacts while accounting for other factors. So it's similar to regression in primary research, right? So we estimated 5 regression models, one investigating the set of all outcomes, and one each for our 4 main groups of outcomes: earnings, employment, public benefit receipt, and education and training attainment. Together, this kind of analysis provides a way to identify the features of studies, interventions, and participants associated with better outcomes. So we look at the relation between the following factors, moderators: primary services, intervention characteristics, outcomes, participant characteristics, contextual, and study factors, study features. I want to share our main findings. The evidence summarized in the Pathways database indicates that programs improved labor market outcomes. Across 144 interventions, there was effect size of 0.047 standard deviations, and it was statistically significant. Translated into dollar equivalent, it was equivalent to 1,000 increase in annual earnings or 2 percentage point increase in employment. Most of interventions did not have important effects on outcomes, statistically significant effects, although the direction of outcomes were mostly positive, in positive direction. However, 29 interventions do show statistically significant evidence of improving participants' average outcomes. Further, 6 top interventions had large effects, a robust effect size of at least 0.25 standard deviations. And some features and factors were associated with larger effects, which we discuss later. To start off our discussion, I'd like to offer a poll questions. One way to examine what works is to consider average effect sizes across all intervention and outcomes with the same primary services. So we classified intervention into 6 groups according to the main service they offered. Here's 6 categories. The question is, which types of intervention do you think will have the greatest impact on all outcomes, all 4 groups of outcomes? Please choose up to 3 categories out of 6. While I'll elaborate on some categories. For example, each category has 2 examples here. Case management or other supports, which includes intensive case management service or health services, such as mental health services or substance abuse, prevention, education and training. Example include occupational trainings, employment retention services, employment services, include job search assistance and job development, incentive and sanctions, focus on providing or taking away benefits such as public assistance or funding for childcare, and work and work-based learning, which include on-the-job learning opportunities such as internship, on-the-job training, and transitional jobs. Please pick out up to 3 choices. So I think we have like 45 seconds to do that. So I'm going to turn to next slide. Well, yep, the highest percentages given to case management are the supports. Actually, it tied with education and training services. Nope, I'm sorry. Yes, and 3rd category, work and work-based learning, following by employment retention service, employment service, and incentive and sanctions. All right, let's look what we had in our data set. In our data set, we had education training, employment services, and work and work-based learning intervention, having the largest statistically significant effects. These case management and other supports and employment retention services didn't having smallest effects and actually not being statistically significant. Yet the caveat here, the pattern is the same when we look at employment outcomes only. So this will be essentially the same order. But for earnings outcome, for example, all 6 categories show statistically significant positive effects. So there is no, if you differentiate effects by outcomes, they're a different mosaic. All right, but let's look. This chart shows effect sizes converting to impacts on annual earnings for all outcomes on average, right? So as you can see, intervention focus on education and training, and work-based learning improved earnings by about 1,400 or 1,300 per year, followed by intervention focused on employment service. So these 2 categories, case management or other supports and employment retention service, didn't show statistically significant effects. And and shown the smallest effect overall, right? All right, let's parse out these average effects to the level of individual interventions that had statistically significant average effects. So we remember there were 29 interventions with such effects. So as you can see, these interventions replicate the pattern displayed on the previous slide, and it's not surprising because they contribute to the effect sizes to these average effects, right? 10 intervention, colored in green, focused on employment services, 7 focused on work and work-based learning, as they colored in blue, and 7 focused on education and training services in red, right? It's worth noting that there are a very representative from the lowest category here. So some intervention in case management and other supports category showed statistically significant and positive effects on outcomes. So the top 6 interventions on this chart had large effect sizes, meaning close to or greater 0.25 standard deviations. Let's take a closer look at them. In the context, which type of outcomes they improved, right? So there is 4 groups of outcomes here: earnings, employment, decreased public benefit receipts, and increased education and training. So as you can see, top 3 interventions has education and training as their primary services. These are iBest, Wisconsin Regional Training Partnership Manufacturing Pathway, and Partners for Competitive Workforce, Health Careers Collaborative of Greater Cincinnati. 2 interventions had a primary service on work and work-based learning, recycle force, and good transition. And the last intervention on the list, Year Up, had a primary service of employment services. So we can see that 5 out of 6 improved earnings and employment in neither a short or long run. So this is a 5 effect size with these arrows pointed up. 3 of these 6 improved education and training. So there is not much evidence on the effects of this intervention on participants' receipt of public benefits. So there are only 2 likely non-significant effects measured into interventions, right? Well, it's important to note the limitation of this picture, that each intervention was examined in only 1 study that received a high or moderate study quality rating. So summary effects for each intervention do not represent the totality of evidence that could be obtained from systematic reviews focused on each of these interventions separately. Well, speaking of outcomes, we'll continue with another poll. In the previous slide, we look at types of outcomes improved by the top 6 interventions. Now let's talk about how findings vary across outcomes for the entire group of interventions included in the meta-analysis. So these groups are earnings, group of outcomes: earning, employment, public benefit receipt, and education training. And examples provided shows one of the outcomes which we use for coding. So please pick out one choice from this group of outcomes. You have 30 seconds. Thank you. I'm going to move to the next slide in a second. Right. So, yep. We can see here that employment was the major group, was the leader, and followed by earnings, education and training, and public benefit receipt. And based on our data set of interventions, we had education and training leading the group. The largest effects on education and training were on average 0.10 standard deviation. So this graph shows all 4 groups of outcomes broke down by period, short-term, long-term, very long period. So you can see that education and training is the largest effect, following by employment, by earnings, 0.042, and public benefit receipt, right? It's at the end of the list, 0.029. So we can see that on this chart that effects are relatively similar across time periods in the short, long, or very long term, right? So that's only with exception of employment outcomes, in which short-term employment seems easier to improve than a long-term employment. The difference is statistically significant and equivalent to increase in the employment rate of 1.4 percentage points. So substantively, how can it be explained? Some interventions that boost short-term employment, such as many transitional jobs programs in the Pathways dataset, might be partially responsible for this pattern. Let's look at other factors associated with intervention effects. So we look at how intervention effects vary depending on primary service offered, as well as outcomes. Now let's talk about how findings vary by other factors: intervention, participant, context, and study features. So we identified, coded, and analyzed more than 24 of different features. Some of them are shown on this slide. And we first look separately at each characteristic and then combine them as all in the meta-regression model. So we will highlight statistically significant findings in the slides that follow. So we can see that a group of intervention with a participation requirement, a mandatory requirements, had a smaller effect than intervention without participation requirements. This difference is statistically significant and is equivalent of $500 improvement in annual earnings. So how can it be explained? A problem was obvious explanation that there is no great motivation to participate in intervention with mandatory requirements. Some services, some mandatory services might be less appropriate for participants than they would otherwise select. Let's move to another factor. Intervention with private providers, intervention with public providers had small effects than those with private providers. And the difference of the same magnitude, about $500 increase in annual earnings. As to other intervention features, notably, duration of intervention was not related to effect. So it didn't matter whether intervention lasted 1 month or 1 year. It didn't show in our analysis. For the type of comparison group, we found a statistically significant difference favoring the business as usual comparison in the expected direction. That's now effects vary by participant, gender, race, and ethnicity. there is a caveat in this analysis, as due to data availability, this analysis considered the overall characteristic of intervention participants. For example, whether the sample was mostly Black, rather than the effects for subgroups of participants. For example, effects for Black participants. So the gray column refers to a relatively high share of participants in the sample, and blue columns refer to a relatively low share. So we can see that intervention serving more women has smaller effects. The same is true for share of Hispanic participants, right? As the story is a little more nuanced for Black participants. So we found for all outcomes, we found that Black participants with largest intervention with larger share of Black participants outperforms those with smaller share. But when we ran meta-regression, this effect disappeared, and we found an opposite effect on employment's outcome. That is, intervention serving more people identifying as Black had smaller effects on employment. Our next slide shows a difference between participants eligible for cash assistance and not eligible, and you see that intervention with participant eligible for cash assistance performed worse than those without such participants, right? So this effect didn't hold true when we ran meta-regression, probably because this group was aligned with interventions that that had a mandatory participation requirements. So basically, it disappeared when you combined with other factors in one model. One of the important results, there was no evidence that intervention serving people with higher educational attainment before intervention enrollment was associated with intervention effects. As to settings, intervention delivered in rural settings showed smaller effects than those in urban and suburban and mixed settings, but this should be interpreted with caution because there were only three intervention delivered in rural settings out of 144. Among study features, we didn't find that sample size was sample size of participants associated with effects. Also, type of measure did as effects generated with survey data were generally larger than those generated with administrative data. Let me reiterate several key takeaways from our analysis. So, as you saw, 6 out of 144 interventions had large effects overall, mainly on earnings, employment, and education. Intervention focused on work and work-based learning, education and training, and employment services were most effective on average. Effects tended to be largest on education, followed by employment, and intervention tended to be less effective when mandatory delivered by public providers in rural context, and when serving more women, Black, and Hispanic participants. So there were some caveats, limitations in our analysis. As first of all, we didn't include all outcomes reported in studies. We had an algorithm for selecting outcomes, and perhaps we didn't also look at outcomes related to health or well-being, which could be potentially important. Missing data represents the second challenge. As a rule, some studies didn't report detailed demographic information about participants. And publication bias is a bias which it's a common concern in research synthesis tendency to produce upward results, upward bias, if only published studies used in meta-analysis, as its publishers favor positive statistically significant findings over negative and null findings. So we included both published and unpublished reports, but we haven't conducted formal sensitivity tests for publication bias. So, and I'd like to close by saying that this report is one of the 3 reports produced on the same database. The first one described systematic review procedures and all variables used in meta-analysis. And third, synthesis explored in greater detail how economic conditions, recession, or economic recovery are associated with intervention effects. To learn more, you can find this report on the Pathways Clearinghouse website. You can also subscribe to the Pathways Clearinghouse mailing list for updates. And now I will turn it over to Sarah.
Oops. Great. Thanks so much, Andre.
Yeah.
So I'm excited now to get to talk about the results and some of the implications with our panelists. Harry Holzer will share his thoughts on these meta-analytic methods. Looking forward to hearing his perspective as an economist and someone who studies labor and employment issues. And then Kinsey Dinan will share her perspective thinking about policy for New York City's Department of Social Services. So I'd like to start a discussion with Harry to think a little more about understanding the kinds of findings that these kinds of methods produce. So Harry, to kind of start off our discussion, I was wondering if you could talk a little bit about what sort of considerations should we have in mind when we're trying to interpret the results?
Well, so thank you for including me today. And I found the report overall very interesting and very useful. This approach has some strengths and some limitations, and it's important to be aware of both of them, and I think the considerations are important too. Let me start with a few of the strengths and limitations as well as the considerations. So the strength of this effect is obviously that you can take hundreds of different interventions and get an average impact of these interventions. And in calculating it, appropriately you put more weight on some studies than others for reasons that lots of folks understand. It gives you a clear sense of what works and what doesn't work, or what works less or more, what categories of programs, what specific services seem to matter, and for whom, which groups of disadvantaged folks seem to derive larger benefits versus smaller benefits. And I think all that's really nice to know. I think the real consideration about this is you have to be very clear what is the question that we're trying to answer, because that determines what's the sample of programs that you start with that you want to analyze. And it seems to me that Mathematica decided to cast a very wide net. It was essentially anything that is designed to affect earnings and employment over a long period, like anything over a period of 4 or 5 decades. Some of these programs that, clearly go back to the 1980s or earlier. Some of them are programs we don't talk about much anymore because they're a little bit obsolete. But so you started with this very big sample. I think it was 8,000 manuscripts I read somewhere. And then you whittle it down, you get 315 that have credible evaluations, but only 144 in the end that you use. So you start with this sort of anything that's been rigorously analyzed, but it turns out that the 144, I'm not sure what the 144 represents. What are they representative of? I'm not sure they're representative of the 8,000 or even of the 315. So that just raises a bit of a puzzle. What exactly are we looking at here? And of course, when you do the analysis, we end up finding that the average impacts are quite small. $1,000 per year on average. Matters whether that those impacts last or not. If they last a whole bunch of years, that's when, then it might be cost effective. And we don't talk much about the costs. I mean, the good education and training programs, which generate this average $1,400 impact, those cost many, many thousands of dollars, right? So again, the impact really has to last for that to be cost effective. But, it's basically saying a lot of stuff doesn't work. We know that. We know a lot of stuff doesn't work. For me, I worry that the big takeaways reinforce the impression that most of the stuff doesn't work. Most of the stuff is not cost effective, even though many of us don't really believe that. But it was because it was this take everything out there that's been analyzed. And I come from the point of view actually that sometimes we are a little too quick to use RCTs to evaluate programs that haven't been around that long and where the providers haven't really figured out what works best. The best programs of the ones like iBest and the Wisconsin program, Year Up, some of the others, they take 5, 10, 20 years to really get good, to become good. And you didn't allow that kind of screen. And of course, they take some major resources too. But out of these programs, how many of them have had the chance, the maturity to develop? How many of them have the scale where they can really have some impact? And those kinds of questions I think are very important, but they haven't been answered here. And I just want to quickly throw out 2 recent papers that take a very different approach from this, that I think, again, it doesn't say that one is right or one is wrong, but it gives you a clearer sense of what the question is they're trying to answer. Both papers came out in 2020, both by very well-respected Harvard economists. One was by Larry Katz and co-authors, looking only at sectoral training programs, the category that we all know right now is the most effective, that generates the largest impacts. Or a different paper by Nathaniel Hendren and Ben Spring-Kaiser, looking at 120 federal programs that have lasted and developed scale and been around, in some cases up to 50 years. So you get a much clearer sense of what the question is in those cases that we're trying to answer rather than in this case. But like I said, to really get a clear sense, I think you'd want to define the question and the sample a little bit more narrowly, look at more programs that are much more in line with what we think of now, compare not just effect sizes, but compare benefits to costs, look at how long these things last, and distinguish the mature and scaled programs from those that aren't. And I think that would be a slightly more useful way to go. But again, I think the paper was very useful and very interesting.
Yeah, thank you, Harry. There is a lot of great, interesting points that you raised. A couple of kind of first reactions. I think you're totally right about things like costs, maturity, scale. These are factors that are really important to understand what it is we're looking at. And I'd like to return to the maturity and scale issues a couple of slides ahead here. I think you're right that Pathways does cast a very broad net. And in fact, we looked at programs that directly and indirectly may affect employment and earnings. So you're right, this includes a really broad swath of things. And it's by design because we did want to get a feel for what is that landscape out there. It sounds like one thing I'm hearing is that a lot of insight will come from as we are able to drill down and look at things like primary services. It's a way of grouping programs that are similar in a certain way. What do these sorts of programs, with a certain like work and work-based learning programs, what do they look like? What sorts of findings do we see there? It gives us a little more similarity than looking across kind of a whole heterogeneous landscape of programs. Because right, you mentioned it can reinforce an impression that a lot of these don't work when we're taking an average over so many programs. Another really interesting thing I wanted to pick up on that you mentioned is, programs that have been around a long time versus maybe a program that was, a brand new idea, it's just being piloted. There's there's a study on that program. I think we can learn from. I think it's good to that we keep open the door to things at different kinds of different places along that continuum of sort of program development. There's some novel things, there's some with more kind of established processes and maybe awareness and evidence. And again, it sounds like being able to drill down into those different types of programs can be helpful, rather than maybe we don't want to compare the brand new programs to the well-established programs all the time. To answer some questions, we might want to look at look at those different types separately. Another thing I wanted to quickly mention is, Harry, we do have some small, kind of shorter reports that obviously we're not discussing in this webinar, where we do drill down into specific categories of primary services. Some of these are up on the website, others are in progress, and they'll be coming down the pike. So you'll see things like employment coaching. We looked at evidence on employment coaching specifically, and on how that affects different outcomes rather than combining all outcomes together. Financial incentives is another one, and there'll be others coming up. And at some point down the road, we are going to look into program costs, because that's a huge area that you mentioned. That's very important to compare two programs that may be equally effective. One is wildly expensive, one is not. That's something that would be important to take into account for folks. And thanks for those the heads up about a couple of additional papers, recent papers that we can be aware of too. I'd like to go ahead and to make sure we have time for some other questions. I'd like to jump over to take a different perspective. Turn to Kinsey, who can offer some insights about issues that state and program administrators might be grappling with. Kinsey, it would be great if you could provide an overview of your role and talk a little about how state and program administrators might apply these findings and lessons that they could take away.
Sure, thank you so much for having me. So I lead the Office of Research and Policy Innovation, as was mentioned, at the New York City Social Service Agency, which includes both the Department of Homeless Services and the Human Resources Administration in New York. And so together, these agencies administer a very wide range of programs that serve millions of low-income and vulnerable New Yorkers. And most relevant to today's discussion, those programs include our cash assistance program that draws on federal TANF and state city safety net funds to provide income support, employment services, and other programmings for New Yorkers in poverty, including families with children as well as adults without dependents. So my office is a support team to this program and the other programs that our agencies run. We seek to inform agency decision-making by developing and analyzing the evidence base for our work and providing policy and programming recommendations to the commissioner, executive staff, and the program area leads. So we do this. We have a team that conducts internal research studies and evaluations. We synthesize and share evidence from the field of research in this area. And we also serve as point on a range of collaborative research projects with other city agencies, university-based researchers, research firms, often studies sponsored by the federal government, and so on. And so I'm really grateful to be here today to talk about the analysis we just heard from and share some thoughts from where I sit in city government. I think first, just to say, bringing together findings across studies, both in the Pathways website more broadly and specifically in this analysis, is just incredibly useful. So We are always looking for evidence about what works, particularly what works for cash assistance clients. And it can be difficult to find good models, and it can be difficult to think across studies and what they mean together. And so it's really helpful to see that work out there and to be able to share that back to our program leads. I think more specifically, a really important takeaway for me from this analysis is the support that it provides for education and training programs. It's particularly encouraging to see, right, the positive results from programs that serve a very disadvantaged populations with low educational attainment, for example, like the iBest program. So this strategy really is a priority for our agency's career services leadership as they seek to promote human capital development for cash assistance clients and select other populations. That said, and I think probably a lot of the folks on the call can understand this or have experienced this, implementing robust education and training options for cash assistance clients is challenging. It requires partnerships and infrastructures that are more difficult for a social service agency to implement than more traditional job search and other job placement related services. It's also, and I think this was alluded to in the presentation, it's an option that's not going to be a good match for all of our clients. So, for example, there are some clients that really are looking for a quick attachment to the labor force. It's also not a strategy that is usefully mandated. And so in the context of a cash assistance program, where there are federal and state work requirements, this means that an education and training approach is always going to need to be implemented as part of a much broader model where all work-ready clients can be served and mandated to participate, and served the second day when they don't show up the first day, and then when they don't show up again for a week, right, served again. So you need programs that can really serve the whole population, and education training is always going to be a bit boutique in there. And so given these realities, and I won't talk about cost, but given these realities and cost as well, the evidence that education and training can really be successful, I think, is really critical for leadership that wants to prioritize it. It's not always been the priority of cash assistance leadership here, frankly, going years back, and I think it's not always the priority around the country in these programs. It was also good to see findings supporting other strategies that are really central to our approach. So we provide most of our services, for example, through contracted nonprofit and for-profit providers that are brought on in a competitive process. Providing opportunities for subsidized employment is a longstanding option in New York City. I think, again, in this analysis, as in the research more generally, it's never entirely clear how long those earnings impacts last past the program, but I think, again, that it works. Job search assistance, soft skills training, job placement supports, all of these obviously are key parts of our approach, and it's good to see that there is evidence of their effectiveness. I think, on the other side of that, there are central services that we think of as really core, like employment retention assistance, that didn't come out as strongly in the results. And I'm not entirely sure what to take from that. But I think mostly what I take from it is that we haven't really demonstrated in rigorous studies that we know the best way to effectively deliver these services. So I'd be interested if you think that's a possible interpretation. And so I think, and as Harry was saying as well, the analysis altogether confirms what we kind of all know, which is that this is hard work, right? It's challenging to achieve large positive impacts in workforce development programming. It's particularly hard serving very disadvantaged folks in a mandatory work program. And I maybe just mentioned that with COVID, a lot of those, our mandates have been lifted, but those are temporary policy changes. And so I think as administrators of cash assistance programs, we really need to think creatively about how to offer, support, and encourage employment through a wide range of different strategies, including education. We need to be assessing internally what appears to be working for our clients, what services they participate in, what kinds of outcomes they get, even if we're not positioned necessarily to be doing this in kind of a rigorous random assignment method in most situations. And we have to keep an eye on the research. So I think I will stop there.
Yeah, thank you, Kinsey. That's really interesting and helpful to hear. And it's very interesting to me to hear the perspective that it sounds like the focus on services and primary services is one that's really of interest for you all, kind of thinking about serving clients and challenges in that respect. I'd like to move ahead to a final question to kind of bring together some of these issues. We've discussed ways that practitioners can use and interpret findings, and I'm wondering how it might be possible for us to even go further to make findings even more useful in the future. And maybe I'll start with Harry and come back to the features you talked about, Harry, of kind of maturity of programs and their scale, but maybe other things as well that you might have in mind, other information that you think would make our results even more useful. Harry, do you want to speak to that a bit? And I think you might be muted.
You're right. Sorry about that. In addition to some of the things I've already said, cost-benefit analysis, the scale of the program, the maturity, in some cases, you might even need to do a deeper dive at that. So I'll mention, Wisconsin Regional Training Partnership was one of your most beneficial programs. Year Up was up there as well. Those are both examples of sectoral programs. Again, an approach we know works very well. I don't know if HPOG, the healthcare sector program, was in your sample among the ones. It's been shown not to be very successful. If you look at the kind of the things you've looked at here, the kinds of services provided and things like that, it's going to check a lot of the same boxes as the Wisconsin program and to a lesser extent as Europe. So sometimes you have to do a deeper dive about what's really going on. Why does that approach seem to work in some cases and others? Maybe HPROG was a lot cheaper because they were trying to scale it. Maybe the training didn't last long enough to get people to some of the better paying jobs. Maybe too many folks ended up with certified nurse assistant or medical assistant, jobs that we know are not very good. Or maybe some of the really successful programs like the Wisconsin Regional Training Partnership simply screen out a lot of applicants. We know a lot of those sector training programs want people reading and doing math, at least at the 10th grade level. That's going to exclude a lot of the populations that we care about, that OPRE cares about. So these are the kinds of things I think that we have to really look carefully at. As was said earlier, what works for one population doesn't work for another. If we really want to scale the successful programs, we just have to be clear who's going to benefit from this and who's not. Where do we have the resources to really invest and where not? If we do want just sort of short-term, get them back in the workforce, that's a different, but really drilling down into these programs to really get a sense of why do some that on the surface look similar, why are some effective and why not, along with all of the more easily quantifiable things that you're already looking at.
That's a great point. I love your point about screening too, is really interesting. And we are trying to drill a little bit into some of the interventions through briefs on our website. Kinsey, other things that you might be thinking of that we could include to make the results more useful?
Thank you. Yeah, everything that Harry said, I think I would second. And then just to add that I think a feature that we find is a big challenge and that I see is often kind of highly related to whether you find outcomes or not in these studies is the level of participant engagement. And so one way you can address participant engagement certainly is by screening out people that don't show the first couple times or that don't show the level of motivation that you'd want. But a lot of studies looking at intent to treat model and certainly a lot of programs with mandatory requirements, really end up having very low levels of participation at the sort of receiving the intervention as it was designed. And I think it'd be helpful both to understand how the programs performed in that way and also how participation related to results. And it may be in some cases that really the trick isn't so much tweaking some of the core elements of the program, but really trying to figure out how to keep people there.
Yeah, that's another excellent point. Take-up rates are something that's certainly key to understanding what what an effect really means and why it could be perhaps lower than why it might be low if people aren't taking up our program widely. I'd like to thank you both so much for a really interesting discussion. We have a few minutes left, so we'd like to turn to some questions, and we see there's lots of great questions in the chat. We'll see what we can get through. I'd like to start with the first one about employment retention services and why they're included. These services include a range of supplementary services that, yes, are provided when a client already has a job. But there are services that could potentially help them to keep their jobs and not lose them, potentially improve a job situation. These include things like ongoing case management to address barriers in a job or to assess progress toward career goals. So we do expect that these programs have the potential to affect employment and earnings, public benefit receipt, education, are outcomes of interest. We do differentiate between short and long-term earnings and employment. That was another question. The cutoff was at 18 months. We also distinguish very long-term outcomes when that's reported, but that does not get reported as often. I'd like to talk about questions 11 and 12 together. These are a little bit related. So these questions were, education and training are an intervention that leads to an outcome. Number 12 was, short-term employment is often a result of a short-term intervention. That, different programs might be expected to have effects on different types of outcomes. That might not be a surprise. Let's see. I wrote a note to myself about this. We do like to be able to compare interventions consistently, so we do examine impacts on all outcomes in all time periods wherever we can. But it's yes, effects are certainly may vary across those different types of outcomes, maybe in ways we expect, maybe in ways we don't, and the interventions may be designed that way. So it is important that we are able to look at those different domains of effects as well. I see that we are at time. So thank you again to our panelists. Amzi, would you like to close us off here with the last couple of slides?
Sure, I'll just close by thanking all of our panelists and everyone for joining today. It was a really terrific conversation that I hope we can continue offline. We want to provide you information with ways you can stay connected to the Clearinghouse, which, as you can see here, include social media, our listserv, and our website. And on the next slide, you'll see for more information, or if you have follow-up questions, you're welcome to reach out to the Pathways Clearinghouse or any of our presenters at the email addresses shown here. So thank you again for joining us, and we hope to see you again soon.